work.
Dr. Susan Lee is part of a team from the Royal Columbian Hospital that looked into vaccine effectiveness up to 42 days after the first shot. She says it's hard to evaluate what happens 4 months on because that data doesn't really exist yet.
What we do know, though, is that if you vaccinate everyone with their first dose widely, you will be able to save a lot of lives.
Okay, we've got the large size.
And that's what BC says it's trying to do, give more people their first shot as soon as possible, including essential workers.
I mean, obviously we're in a riskier, day-to-day position than a lot of people.
BC is hoping that with its new timeline and additional shipments of the AstraZeneca vaccine, frontline workers can start to be vaccinated next month.
And Briar, so this is a bold move by BC. What are the vaccine manufacturers saying about it?
Well, Adrienne, both companies recommend sticking to the original schedule. And for Pfizer-BioNTech, that's 21 days between doses. For Moderna, 28. But both companies do acknowledge that during the pandemic, health authorities are going to make their own recommendations. Now, BC is basing its decision on data within Canada and from around the world, including from countries like the UK and Israel, about just how effective the vaccine can be after a single shot. In fact, health officials here have called it miraculous, saying that one dose can offer at least 90% protection. Dr. Henry says that protection could last months, which is why the second doses are now being pushed back, all in an effort to vaccinate more much earlier.
Interesting. All right. Thank you, Briar.
Now, worth pointing out, Quebec made the decision to delay second doses back in January, and they're moving quickly to vaccinate at-risk groups. Now, anyone age 70 or over can book a vaccination appointment in the Montreal area.
It's here that the forest is burning in Montreal, so they have decided to bring down the age limit.
Yeah, it was just last week the Montreal area target group was those 85 and older, a cutoff that still applies in the rest of the province. But in COVID-19 hotspots of Montreal and Laval, things are picking up. Now in Ontario, the question of who can get vaccinated when is more complicated. The rollout has been downloaded to the province's 34 health regions. And as Magda Gabraselas explains, it's a patchwork that some are finding confusing and frustrating.
Braving the bitter cold for some COVID protection. First day slots for vaccinations filled up fast in York Region.
Very excited this morning when my daughter called me at 8 o'clock in the morning. Mom, I booked it. You have to go.
Those age 80 and above can now get their shots in this area and several other regions. But that's not the case province-wide, and those left out are fuming.
I'm extremely frustrated that living in Toronto, I can't get a vaccine for my mother-in-law. She lives just a few kilometers from where people can get vaccines.
This family doctor is just as frustrated. She says the vaccine rollout has her patients asking questions she can't answer.
I wish I could tell them when it's going to be their turn, what it's going to look like, how they're going to get their vaccine, where they're going to get their vaccine.
Today, the Premier defended the province's progress.
As we get more vaccinations from the federal government, then we'll be able to ramp it up. There's certain regions that are ahead of other regions just due to population and other reasons.
The other regions will soon catch up. That's the promise made by the head of the vaccination task force today.
By 15 March, we will be doing 80-year-olds and above right across the province of Ontario.
For Rosie Schwartz's mother-in-law, who lives alone, that can't come soon enough.
She's very unhappy. She wants to be able to see family members. Every day at 98 is a gift, but she is not able to enjoy it.
Schwartz looks forward to the day when her mother-in-law can be fully vaccinated. So far, more than 260,000 people in the province have received their 2 doses of the vaccines. Magda Gabraselas, CBC News, Toronto.
Now, Ontario's emergency brake went into effect today in 2 regions. The measures put those regions back into more restrictive lockdowns. So the regions of Thunder Bay and Simcoe-Muskoka have seen a rise in new infections in recent weeks. New restrictions include prohibiting in-person dining and personal care services. Social gatherings also limited to outdoors with up to 10 people.
Over 99% of Alberta businesses are able to operate now within public health guidelines, and today a very important lifeline for the owners of fitness businesses, including gyms in that respect.
And indeed, in Alberta, fitness centres and libraries were given the green light to partially reopen as the province moved to ease some public health restrictions. Premier Kenney says more could be lifted in the coming weeks if the numbers continue to improve.
In Nova Scotia, couples in long-term care now have the right to stay together. The new rules were in the works before COVID, but the pandemic has underscored the impact of loneliness on health. Kayla Hounsell has one couple's story.
I love you.
When 96-year-old Hazel Gibson is not having a good day, her husband Bryce is by her side. Their family fought to make it so.
He's always been absolutely, totally in love with her, and she has been absolutely, totally in love with him. It is a love story made in heaven. It really is.
The couple has been married 78 years. Yes, 78.
Long time, almost all our lives.
But 3 years ago, they were separated in different long-term care facilities. At the time, Hazel told us it just wasn't the same.
And it is awfully hard to be parted. And I wake up in the middle of the night and roll over and Bryce's not there.
It was absolutely horrible because I was watching her deteriorate as each day went forward because she wanted to be with him badly.
Nova Scotia's new law aims to prevent that from happening to anyone else. Couples now have a right to be placed in long-term care together, even if one of them requires a higher level of care.
We think it's the right thing to do. The transition into long-term care can be challenging on the best of days, and helping keep couples together who've been loving each other and supporting each other their whole lives, I think is a really good thing for all involved.
In fact, this professor of geriatric medicine says it can be a good thing for the healthcare system overall when couples can help each other.
That can be beneficial to their sense of self-worth. And it can also be something that just takes that particular task perhaps away from being needed to be done by a care worker and then frees that care worker up to do something else.
Judy Gibson says there was a definite change when her in-laws were reunited.
You could see hearts the day that we walked them in together.
The family is happy others won't have to put up a fight and will simply have a right to be together. Kayla Hounsell, CBC News, Halifax.
Manitoba RCMP are fighting in court to keep an officer's notes away from investigators. Those notes describe the night police charged a First Nation man with assault. Months later, that man took his own life. Caroline Bargout shows us why the officer's account is now under scrutiny.
Brian Halcrow's friend has fond memories of the 50-year-old from Titasqueak Cree Nation.
Brian was my confidant, my best friend, the person I turned to, good and bad times.
He was his mother's primary caregiver, but he also struggled. After 2 major strokes, he couldn't work and suffered chronic memory loss. Last January, 7 months after a run-in with Thompson RCMP, Brian Halcrow died by suicide.
I want to hear that what happened to Brian should not have happened.
On June 5th, 2019, RCMP were called to a hotel bar for reports of a man causing a disturbance. Court documents say Halcrow was upset and threw his baseball cap at police. It didn't hit anyone, but an officer turned around and punched Halcrow in the face, twice. He needed 4 stitches, then was taken to hospital and charged with assault. Halcrow's sister says the thought of doing time was too much for her brother to take.
Brian said to me, "Patsy, I'm not going to jail. That's the worst place to be. I am not going." I sort of, just like I knew what he was going to do. I was waiting for that call.
The Independent Investigation Unit of Manitoba charged one constable with assault. The investigators now want a copy of his notes, but RCMP say they can't hand them over. Manitoba's Police Services Act protects their charter rights against self-incrimination. The case is set to be heard in court on Friday. Caroline Bargout, CBC News, Winnipeg.
Well, for the first time, a former French president has been sentenced to time in prison. Nicolas Sarkozy was found guilty of trying to bribe a senior magistrate with the promise of a prestigious job in return for information about a case. The sentence is 1 year in prison and 2 years suspended, but a lengthy appeal is expected before he serves any time.
Aung San Suu Kyi has not been seen since Myanmar's military coup a month ago. Her lawyer says she attended court by video today, facing more charges. As Renee Filipponi reports, her supporters don't need to see her to keep fighting for democracy.
Homemade barricades stand between protesters and security forces. The crowd has come prepared, undeterred by Sunday's bloodshed. Tear gas is fired, creating chaos as people flee the military that's becoming increasingly violent. This engineer says he will keep fighting peacefully against the dictatorship. We are not feeling good to see Yangon as a war zone. Many have died already. Grief is marked in the streets by flowers, with growing memorials for the lives lost. And in eastern Myanmar, a funeral for one of the 18 people killed over the weekend.
What is most needed is the United Nations, especially the Security Council, to start to walk the walk.
Young Hee Lee is a former UN Special Rapporteur on Myanmar and is now launching an advisory council calling on the world to do more. The military, known as the Tatmadaw, seized power and arrested leader Aung San Suu Kyi 1 month ago and shows no sign of backing down.
The behaviors of the Tatmadaw are exactly like what a terrorist group would behave, and therefore any recognition of that state under this type of governance will not be accepted.
Suu Kyi is being held at an undisclosed location and made a court appearance by video today, according to her lawyer, who saw her for the first time.
The prosecution side added 2 more cases.
She was charged with 2 additional offenses, including inciting arrest, he told reporters. Supporters believe the charges are false. And despite the crackdown and reports 1,000 people were arrested Sunday, the protesters remain resolute in their fight. Renee Filipponi, CBC News, London.
There were well wishes for Prince Philip on the streets of London today as he switched hospitals for additional care.
People think he's a bit silly and a bit daft, but I think he's done great for the country, so should deserve the best care he gets.
Open umbrellas were used to shield the 99-year-old from cameras as he was moved to a London heart hospital. The palace says he'll undergo tests for a pre-existing heart condition and he'll continue treatment for an infection. His hospital stay of nearly 2 weeks is now expected to last weeks longer.
A story of one man's enduring torture in Guantanamo Bay. It made it to the silver screen. It's now getting award show buzz.
He has been interrogated. He has been held against his will for 6 years.
Coming up, we speak to actors and the real man at the center of the story about the role he says Canada had in his detention.
The Canadian intelligence authorities conspired with the United States.
Plus, a hot housing market. Well, it's a different reality in commercial real estate.
There's some folks who say, no matter what, I don't need what I had before.
What it means to have so many open spaces and...
It's like a dream, a wonderful dream come true.
A Canadian artist gets a dream opportunity with Disney.
I think it's life-changing.
We're back in 2.
Welcome back. WestJet isn't saying how many will go, but it is about to lay off more pilots. For now, the airline and the union for the pilots are in negotiations. An already announced layoff of 120 cabin crew members is set to take effect tomorrow. And Porter Airline flights will not return until May 19th. The carrier pushed back its start date from March 29th. It says it is because of a new rule that passengers returning from foreign destinations wait in quarantine hotels for COVID-19 test results. Porter's operations have been suspended since last March.
Well, with the pandemic forcing employees to work from home, lots of businesses are rethinking their plans for office space. And as Jacqueline Hansen shows us, that sagging demand for commercial rentals has led landlords to sweeten their offers.
Masked up and spaced out. The search for office space this year is different. Last March, executives at Ottawa-based company RVZ were on the hunt for a new office. Then the pandemic hit. The online RV rental marketplace sent employees home to work remotely and put signing a lease on hold. Since then, RVZ's business has doubled and its workforce has nearly tripled.
We were just happened to be one of the fortunate businesses that was well suited during this pandemic.
Up there, you've got.
Now it's on the search again, and not only the company's size has changed, so has the rental market.
We had probably 4 to 5 options that we were looking at. At this time, it's really endless.
Recent data shows office space availability in Canada has been climbing, especially in major urban centers. In Ottawa, the availability rate increased by 13% from the fourth quarter of 2019 to the fourth quarter of 2020. In Toronto, it jumped more than 40%, and in Vancouver, more than 50%.
It was like night and day. Before the pandemic, it was very difficult to find space.
A growing proportion of the space up for grabs is subleases, tenants who want someone else to take over some or all of their lease.
There's some folks who say, no matter what, I don't need what I had before.
This commercial real estate broker says that's affording opportunities to those who may not have had them otherwise.
I am working with a national not-for-profit who normally might have 10 decent options, had at least 30.
And he says some landlords are even offering big incentives, from a year of free rent to money for renovations.
There's going to be a huge amount of capital required to go and transition these spaces into these hybrid hub models.
A hybrid space that supports remote and in-person work is what RVZ is looking for now.
We kind of have to reimagine what is our new office going to look like.
A new challenge of choices. Jacqueline Hansen, CBC News, Toronto.
The film The Mauritanian captured a Golden Globe for its adaptation of a painful story.
I think I figured out why they built Guantanamo.
We speak with the actors and the real man brutally tortured for years about how Canada was involved.
Canada, as the intelligence community started to interfere in my life and turned it into hell, I was
That's
really
next.
scared.
Stay with us.
I didn't have
For 8 years, I have been dreaming of being in a courtroom. Now that I'm here, I'm scared to death.
He was locked up for 14 years without charge in the notorious Guantanamo Bay military prison. Tortured, it's believed, more than any other detainee. Now, Mohamedou Ould Slahi is the subject of an award-winning film, The Mauritanian. Last night, Jodie Foster earned a Golden Globe for her role in the movie as Best Supporting Actress. In her speech delivered from her home, Foster thanked Slahi.
You've taught us so much about being a human being, about being joyful and loving and forgiving.
One thing missing from the film is the role Slahi thinks Canada might have played in his rendition to Guantanamo Bay, and why he believes Canadian authorities are partly to blame for his imprisonment. Tonight, you'll hear from him, from the actor who played him, and from Jodie Foster, who portrayed his lawyer. All three share one hope, that the film leads to change.
Never did I believe that the United States of America would use fear and terror to control me.
The trailer for the film The Mauritanian leans heavily on the fear and the humanity of the fight to free Mohamedou Ould Slahi from his Guantanamo Bay prison.
Maybe he's guilty.
Maybe he is. We're doing our job.
What it barely shows you are the harder-to-watch scenes from the film. Torture at the hands of his American jailers. Scenes real enough, they fundamentally shook Tahar Rahim, the actor playing Mohamedou.
I wanted them to shackle me for real, to put me in cold cells, to waterboard me, force feed me. I was in such an emotional state that I almost felt like my mom, my real mom, was in the cell. And it was almost unbearable.
Whatever I say, it doesn't matter.
He said he wanted his performance to be accurate for one audience member in particular, this one.
Oh, your name is Adrienne, is that correct?
The real Mohamedou Ould Slahi, who admits he has not and cannot watch the whole film yet. Too close to reality and yet not nearly as bad.
Guantanamo Bay is much worse than what you could see. I mean, 70 days without sleeping, with incessant interrogation. You cannot put that in a movie.
From his real-life lawyer, Nancy Hollander, to the woman who played her, Jodie Foster, Mohamedou is a man horribly wronged and owed justice for being stripped of his rights.
He survived by being a better person, right? By being loving and affectionate and vulnerable and open and full of joy. You know, he would not let them break that. He would not let them take that away from him.
Mohamedou's catastrophe goes back to 1990, when he joined Al-Qaeda in Afghanistan, back in the era when Al-Qaeda was an American ally. He left the group, renounced it. His cousin stayed close to Osama bin Laden. In 1999, Mohamedou briefly moved to Canada, got permanent resident status. What was supposed to be a dream life was not. Canadians just want to know what life was like for you here in Canada.
It was horrible. It was a nightmare.
In Montreal, he made some friends who introduced him to a mosque, the same one attended by Ahmed Rassam, the so-called Millennium Bomber, arrested only weeks after Mohamedou arrived in Canada. So Mohamedou's past, his cousin's connections, the coincidence of attending the same mosque as Rassam, all of this set off alarm bells for Canadian authorities. He was followed and surveilled.
In Canada, as the intelligence community started to interfere in my life and turned into hell, I was really scared. There is no reason, to interfere in my private life, when there is just no reason. This is not a dictatorship. This is Canada. This is a liberal democracy. This is a place where people seek refuge.
He tells of waking up to a strange noise coming through a wall behind his head.
I called the police and I explained to them what happened, and I showed them that someone from the next apartment has drilled in our room.
It was, he came to believe, an attempt by Canadian authorities to install cameras or microphones to spy on him. Scared, he left, went back to Mauritania, and then came 9/11. In the months after, like hundreds of others, Mohamedou was taken by the Americans,
Here, with a bag on my head and chains around my body.
bundled off to secret sites, locked in Guantanamo, accused of being a 9/11 recruiter.
He put those men on my husband's plane?
Held for 14 years, never charged, but demeaned, tortured, the Americans trying to beat confessions out of him. Based in part, he was led to believe on what Canadians had said about him.
The Canadian intelligence authorities conspired with the United States, with my government, and lured me to Mauritania and kidnapped me.
Canadian interrogators even traveled to Guantanamo to question him. All these details ultimately an ugly education for the actors.
What the hell do you know about my life? This is it. This is my life. I spend my time in places like this helping people like you. That's what I do.
There were a lot of other governments that were involved in Mohamedou's case, certainly Canada, because he had gone to Montreal at some point, and I guess he had gone to the same mosque as somebody who had been a terrorist. I mean, I guess it didn't matter that there were thousands of other people that had been to that same mosque, but it really took the ACLU about 15 minutes to debunk every quote unquote fact that the government had on Mohamedou.
The film gives Canada a free pass. It's not blamed for any of what happened to him. Mohamedou, though, home now in Mauritania, has questions.
I want an apology, official apology, from the role that Canada played in my rendition, torture, and illegal imprisonment for about 20 years. And I'm dying, I'm thirsty for Canadian intelligence to come clean and just tell Canadian exactly what they did, how they helped the United States.
He and his lawyers have tried and failed for years to see the reports Canada shared with the Americans. Neither CSIS nor the RCMP would share details with us either.
Someone has to answer for the tower. Someone. Not just anyone.
But just maybe, with the film generating buzz about Guantanamo and the men still there, another conversation starts about the Mauritanian and Canada.
So among many other things, Adrienne, it's striking to hear Mohamedou say that he wants an apology from Canada. Is he going to get it?
Well, he's just sort of starting that process. He's still trying to understand exactly what it is the Canadians said to the Americans. He's also advocating very hard for the closure of Guantanamo Bay, as are many other people connected with the film. They just keep hoping the more traction the film gets, the louder that conversation gets.
Right, okay. Coming up, as more vaccines get approval in Canada, the differences between them are becoming hard to ignore. Is one vaccine as good as the next? And should that change how and when you plan to get your shot? We'll have a doctor give you the answers you need. Plus,
Find the button. Find the button. Good girl.
Trained in a pandemic, the creative way to teach service dogs. Stay with us.
Welcome back. So let's talk about vaccines. Now that Health Canada has given its approval to the AstraZeneca vaccine, there's a lot of confusion about just how effective it actually is. And it's these numbers that people are pointing to. So in its clinical trials, the AstraZeneca vaccine had an efficacy rate of 62%, which seems far lower than the Moderna and Pfizer vaccines, which were both above 90%. So it's tempting to think that one vaccine is far worse than the other. But experts say, first of all, consider that no vaccine is 100% protective. The very common MMR vaccine for measles, mumps, and rubella, for example, according to the CDC, it is 97% effective against measles, only 88% effective against mumps. So what's the right way to interpret these numbers? And does a lower number mean the vaccine is any less worth getting? Infectious diseases specialist Dr. Suman Chakrabarty is here to help us explain. So Dr. Chakrabarty, what do these numbers actually mean? Does 60% efficacy for the AstraZeneca vaccine mean that 40% of people who got that vaccine still got COVID?
No, and that is a very, very important thing to look at. This is looking more at a comparative ratio almost, kind of comparing the two, where you see the risk of not getting the vaccine, and then you look at the risk of COVID getting the vaccine, and then comparing those numbers to each other. And you can see there's a significant protection in people who have gotten the vaccine, and it's not saying that 40% of people that got the vaccine also got COVID. So that's a very, very important distinction.
Right, because the most important part of the protective effect of the AstraZeneca vaccine as we know it would be what exactly?
So that's the really important aspect. If you look at the people in AstraZeneca who got the vaccine and also got COVID, there was one very important thing. Nobody who got COVID died. Nobody who got COVID got hospitalized. And that's really, really important because death and hospitalization, along with transmission, are three of the most important metrics for COVID in the community. And if you're able to prevent those, that is essentially our ticket out of the pandemic.
Right. So we have data supporting that notion about the extent of severe illness, which we see or don't see when it comes to the AstraZeneca vaccine. Do we know anything about long-term illness? So I'm thinking about long haulers. Right? Does the vaccine have any protective effect in that sense?
The answer, we don't know quite yet, and I think that data right now is being amassed. And I think one of the big things that we do know is that when you get illness after getting a vaccine, it is often more mild. There are certain changes that are happening behind the scenes, and I suspect that if it is making the disease more mild, it can significantly prevent these types of long-term complications. Time will tell, but my hypothesis is that it will help to reduce the incidence of that.
What about how we interpret the 60% efficacy rate as it pertains to transmission of this coronavirus? So not getting sick from it, but if I get the AstraZeneca vaccine, am I more or less likely to give the coronavirus to someone else compared to someone who got the Pfizer or Moderna vaccines?
This data is also really coming together as well. So what we do know from previous observations, even before vaccines, that people who have less severe illness are less likely to transmit the virus to others. So, looking at the vaccines are doing this, and we're starting to get more accumulating data that this is actually the case, that we're getting less virus, in your nasal passages, for example, and this means that you transmit it less. So the evidence is really pointing in that direction. So you have now something that decreases death, decreases transmission, and decreases hospitalization. This is all the big three things that we need to do to get this pandemic in check. This is our ticket out of it.
In your mind, that's the bottom line, that if I think I should not take the AstraZeneca vaccine in favor of waiting for a more effective one later, you would tell me what?
I would tell you that right now, as it stands, I would say to get whichever vaccine is available to you. It's going to do what it needs to do in terms of preventing hospitalization and death. At a later time, we might be able to, when we have a surplus of vaccine, tailor it a bit more. But right now, this is what's going to get us out of the pandemic. We have it in our hands, now we just need to put it into our arms.
Dr. Chakrabarty, thank you for your time.
Thanks for having me. Take care.
Okay, so we covered a lot of ground there, but we are preparing for a special live national town hall on the vaccine rollout next week. And we're looking for your questions. We want to hear what you want to know on the differences among the vaccines, on Canada's supply, or where we are in the vaccine queue. You can send your questions and stories to covid@cbc.ca.
Now, nearly 22,000 Canadians have died after contracting COVID-19. We've been bringing you some of their stories as told by the people who loved them. Tonight, a mother remembers her son who died 4 months ago.
My name is Maria Medill,
And my son, Jeff Lauren Medill, passed away on October 28th in India at the age of 44 because of COVID. He was in a city called Udaipur. In April, when he wanted to come home, he couldn't because everything was shut down. Jeff was the oldest of my 3 children. Traveling, living on the edge was his niche. He worked in the IT department of the International Red Cross. He was sent to places like South Sudan, Mali, the Ivory Coast, Niger, in India. He started in July a school within his community for 4 years old to about 12 years old. He also fed them a nutritious meal, all at his cost. I was not surprised, but I sure was proud. He never had a spouse, a partner. He never had children, but he loved his 2 nieces so much. And friends, he had friends far and wide. When his death was announced, I got from all over the world, England, Japan, Australia, people who he had met through his life. He was extremely intelligent, extremely kind, and everyone loved to be around him. He loved debating about politics, religion, the meaning of life. And that's what I used to talk to him about too. I love you. I miss you so much. You live in my heart, and you have given me so many things to think about in life and showed me an example of how to live for others.
Proud mom. Jeff Medill was just one of nearly 22,000 in Canada lost to COVID-19. The stories of the lives of many of them are being told through our interactive website. You can find it at cbc.ca/remembered.
It's my job to speak for the dead, because the truth never dies.
Coroner, Wednesdays at 8 on CBC and CBC Gem.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast Front Burner, how recently declassified U.S. documents reveal that Saudi Arabia's campaign to crush dissent extends far beyond the murder of Jamal Khashoggi. Subscribe wherever you get your podcasts.
Well, the pandemic has forced students everywhere to embrace new ways of learning, right? But when the pupil is easily distracted and prone to barking, it calls for a special kind of creativity. Stu Mills now on how guide dogs are being trained for the real world, and one that COVID has shut down.
Class is in session at the Canadian Centre for Guide Dogs. In fact, it never really stopped.
Oh, good girlie. Well done. Yay!
But how these guide dogs are trained has changed a lot. Trainer Ian Hadlam is letting 2-year-old Dahlia lead him around this fake construction site. Over the past year, when the pandemic has made the streets off-limit, Hadlam and other canine students like Fawn have improvised.
Find the button. Hop up. Find the button. Good girl.
COVID lockdowns have forced trainers to think of creative ways to prepare the pooches for a world where traveling, shopping, and dining are possible.
All of that we want to expose them to as much as we can safely so that they think it's just a normal part of life and it doesn't throw them for a loop when they're guiding through it.
So, dogs have taken field trips here to the unusually quiet Ottawa airport. They've worked on escalators, etiquette, and outside, how to keep an eye open for crosswalks. The Canadian National Institute for the Blind runs another guide dog training centre. President Diane Bergeron says most of their puppies come from outside Canada, but they've been blocked by closed borders.
You know, we say it rains cats and dogs, but it actually doesn't. I can't produce a dog suddenly that is at the exact right age to train, nor can I just take a dog from a rescue organization and train it to be a guide dog.
Bergeron says the biggest challenge has been exposing young dogs to crowds, like on a jammed subway platform at rush hour or a day at a festival.
That's one piece that worries me as a guide dog handler myself. I'm a little bit worried that when our dogs get into those situations moving forward, they're not going to have enough of that training.
Bergeron says if need be, the animals will get some extra lessons. But both guide dog agencies say even though they'll have been trained in a pandemic, the dogs will be capable of figuring out the new normal whenever it arrives. Stu Mills, CBC News, Ottawa.
Next on The National, a Saskatoon artist gets her big break.
I'm the first Canadian. It's just thrilling.
How this Canadian is joining the elite ranks at Disney. Our moment is next. Denise Klett is an artist and a Disney superfan. Now, usually painting a Disney character for profit will land you in copyright trouble with the giant company, but not for Denise. The Saskatoon artist has been signed as a licensed Disney fine artist. There are only about 30 in the world. She is the first Canadian, and tonight, she's our moment.
I've been painting for 40 years. To be a Disney fine artist, I'm licensed, so I am able to pick from the different Disney catalog of movies, and I can create it in my style of art, which is painting and sculpting. It's about 30 to 40 people, artists from around the world, and I'm the first Canadian to ever sign with them, which is just thrilling. I put on a Disney movie or the Disney music behind me, which drives my husband insane because it's over and over again. I think I know every Disney movie by heart. Mom and Dad took us children when I was 6 years old to Disneyland, and I remember watching the fireworks and seeing Tinkerbell fly across the sky, and from that moment on, I thought she was real. Now to be able to use my skill set and create for them is, oh, it's a dream come true.
Wow, so that's beautiful stuff. I didn't even know that job existed, first of all. But it sounds like she has quite a lot of agency, right? To kind of pitch into the process and really get the ball rolling.
And then it gets a little weird because she pitches, she gets a color concept, it goes to one team, then they send it to Disney, they look at the colors, the proportions, they say yes or no. It's very complicated, but clearly very exciting.
Neat.
That is a national for March the 1st. Yes, it is March. Good night.
Good night.